I work in the Grantham Institute, which is Imperial College's kind of hub for climate change and the environment. Hopefully that should, big screen, yeah, okay. And also part of a team called the Climate Cares team, which is focused on the links between climate change and mental health. And that'll be an aspect I'll bring out today as part of the kind of puzzle, if you like, which often gets overlooked. So we're talking about the UK's public experience of extreme heat, some of the impacts it has on mental health and relevant solutions. So firstly, start off by sharing some insights we got from a nationally representative sample that we ran of the UK public last year in October. This was run nationally representative on the basis of age, gender and ethnicity, and we had just under 900 respondents from around the UK. And we essentially asked people about their experience of extreme heat and what they thought about the risks it posed in the future. So we asked this question about how concerned people were about heat waves and very hot weather. And so as you can see here, around 40% of the population were, oh, sorry, bear with me a second, I can't just see the top bar at the moment. Yes, you can see around, over a third of the population were either very or extremely concerned with heat waves and very hot weather. We asked about people's lived experience, what it was like in their home. And half the respondents said that they somewhat agreed or strongly agreed with the statement that where they lived got uncomfortably hot indoors during heat waves and during very hot weather as well. And perhaps unsurprisingly, this then translates through into having a knock-on impact upon people's ability to sleep. So again, over half of respondents agreed or strongly agreed with the statement that where they lived, they really struggled to sleep during those uncomfortably hot nights. And so in terms of the kind of impacts that both the kind of lack of sleep can have, but also people in people's workplaces, their experience of where they work, whether that's working outdoors or if they're working from home, their workplace negatively impacting their ability to actually get decent work, set of work tasks done during the day as well. So here, over 40% of people struggle to get their work tasks done at work because it was uncomfortably hot where they were based. And we asked people whether over the last 5 years their health had been negatively impacted by extreme heat. And we also asked them at the same time whether they had, at the time they were completing the survey, any underlying health conditions. And what we found is that only about 1 in 8 respondents who didn't have a current health condition had reported experiencing negative health impacts from extreme heat over the previous 5 years. But when amongst people who had an existing mental health condition or a heart condition or a lung condition, these values are much higher. And particularly, as you can see here, from those who had a mental health condition. So those who had a mental health condition now, 37% of them said that their health was negatively affected during periods of extreme heat over the last 5 years. So substantially higher than people without any underlying health conditions. I'm just going to elaborate a bit more about why this may be the case, and because it's important in terms of what we think about when the provision that's there to support vulnerable populations during periods of extreme heat. So the question is, how does extreme heat affect mental health? We know from work done by colleagues here at Imperial that there is roughly 10% higher incidence of hospital attendance for psychiatric disorders during heatwave periods. The kind of precise way in which this happens is still something which we're learning about, but a factor is the fact that some people who have certain psychiatric conditions will be taking medications such as lithium. So their mental health condition and the medication they take for that can impair their body's ability to regulate their temperature. So their mental health condition then increases the chance of physical health impacts during those periods of extreme heat and their ability to regulate their own temperature. It's been found that during extreme heat events, people with pre-existing mental health conditions are 2 to 3 times more likely to die during those heat periods. An extreme example of this was from the British Columbia heat dome, which hit Canada and America back in 2021, on that kind of the border. But in British Columbia, it was measured that 8% of those who died during that heat dome had schizophrenia. And this is kind of, again, a complicated picture, but also relates to the high levels of homelessness and the particular vulnerability of that group of the population. The Environmental Audit Committee recently ran an inquiry on extreme heat and heard in that inquiry that suicide risk in the UK is twice as high when the temperature is 32 degrees compared to 22 degrees. And as we heard from some of the previous presentations, extreme heat can have a significant impact on social isolation, both for the elderly, but also for the impact on kids and their ability to go out and play. We see increased rates of domestic violence during periods of extreme heat, can disrupt education, and so on, all of which can have a negative impact on mental health and emotional well-being. And so this is, I suppose, looking at the impacts of extreme weather events more broadly, but this is data from the Climate Council of Australia, who did a survey with people who'd been affected by extreme weather over the previous few years. And as you can see here, there were significantly sort of higher than average levels of anxiety, of symptoms of depression, of disruption of sleep, symptoms of post-traumatic stress disorder, in some cases leading through to increased rates of alcohol abuse associated with people who've been experiencing extreme weather events. This is not just extreme heat, this relates to things like people having their houses flooded and wildfires and things as well. But the point is there in terms of the negative impact on mental health that extreme weather events can have. And so a recent study has kind of looked at trying to put a financial value on what this may look like in the future in terms of the increased burden financially, globally. And this work by Kumar et al. Estimates that there's the potential impact of over $500 billion per year globally in terms of the additional mental health burden due to climate hazards coupled in with air pollution and a lack of green space. I mean, it's worth obviously noting that at the moment, the phrase that's often used is that all countries are developing countries when it comes to the provision of mental health care. And so at the moment, there is a general lack of support in terms of that provision of mental health care generally. And there's a significant risk of existing inequalities being widened. And so thinking about groups that are particularly vulnerable, where do these vulnerabilities lie when it comes to the mental health impacts? We know that people with existing mental health challenges are more likely to be negatively affected. Certain occupations, so people working on the land, for example, more likely to be affected due to direct exposure to extreme heat, but also because of that connection to the land and being more likely to be impacted by crop failures, for example. We've got a range of different factors here. Other ones I'd bring out would be things like institutional factors. So for populations who are in prison and long-term psychiatric institutions, the nature of that infrastructure, which is obviously designed to keep people in, also increases the risk of people being exposed to extremes of heat as well, with attendant impacts upon mental health. And so just to then come through to some of the kind of solutions. So while climate change can be a kind of a multiplier of negative impacts, climate action can also be a multiplier of positive benefits as well. So I mean, I know you'd be very familiar with these kind of opportunities that exist, but just to really emphasize the additional benefits that things like green and blue space can pay for improving mental health via reducing the urban heat island effect. Green space itself can be really supportive of people's mental well-being. That kind of access to nature is really important. The provision of cycling and walking facilities is maybe slightly surprising one to have here, but extreme heat can interact with poor air quality, and poor air quality is a factor that affects mental well-being as well, increases rates of things like dementia, as an example. So improving air quality as well as being good in itself and reducing carbon emissions and more active travel and so on can also help to improve benefits for mental well-being. Energy efficiency, so we know it always needs to be done right to maintain that ventilation, but obviously a well-insulated house can also provide benefits for reducing the risk of overheating, as well as helping to improve things in the winter months. And ultimately, to be more resilient, communities need to be better connected, and there's opportunities there for improving mental health and connectedness via getting those structures in place, such as what we heard from in terms of the work that voluntary communities do to bring together people so that they're better connected and better able to support people during periods of extreme heat or other extreme weather events. Just to highlight a few other things that can be done. Ultimately, we know this is all about trying to reduce risk of populations and reduce exposure, and getting things in place so people are supported before, during, and after these extreme events happen. So that could be around access to cool spaces, hydration, supporting vulnerable populations, as we heard already. In the context of mental health impacts, advice to vulnerable populations, for example, about the risk of overheating, advice around their use of medication, and then things that local authorities can do in terms of capturing data on homes that are prone to overheating to try and intervene to help to reduce the risk for vulnerable populations particularly. One specific example I bring out from Australia, this was a health warning system, health heat warning system introduced by the Southern Australian government, targeting vulnerable populations or at-risk groups, including those with mental health conditions during periods of extreme heat, sending out those kind of warnings. During the heatwave event, they estimated the cost of introducing it was just under 600,000 Australian dollars. And the estimated savings in terms of reducing the number of people going into the kind of hospitals and the A&E and the like was 1.5 to 2.5 million Australian dollars. So putting a good kind of evidence base for the efficacy of these kind of interventions. And the last thing I'll just share, and I'll post some of these links in the chat afterwards, is that over the last few years, we've been convening a kind of global dialogue on climate change and mental health. And through this website called Connecting Climate Minds, we've developed a kind of series of case studies from around the world about how organizations and community groups are kind of tackling this issue and trying to get more action on the links between climate change and mental health. And this is something which I hope to be a kind of a live platform. So please, but it's a two-way thing. If you have case studies, please do get in contact with us, but vice versa. And please do take the chance to have a look at some of the examples of good practice that we've pulled together already. And that's it. And thank you very much for the time.